Associate Professor David Dewar, and I'm an orthopaedic surgeon and one of the investigators of the roadmap trial. When someone has an infection in their prosthetic artificial joint, they're usually treated with both surgery and antibiotics to help clean the joint and fight the infection. In this video, I want to tell you briefly about the types of surgery that are usually used to treat prosthetic joint infection and the surgical part of the roadmap trial, which we call the surgical domain. In the roadmap surgical domain, we want to find out which of the surgery techniques we use is the most effective for people with a prosthetic joint infection. None of the surgery types in the roadmap study are new, and all have been proven to be effective for prosthetic joint infections. We just don't know if one is better than the other. One of the most common types of surgery used for a prosthetic joint infection is called debridement, antibiotics, and implant retention surgery, or DARE for short. In a DARE operation, after the patient is anaesthetized, we open the affected joint space and clean out as much of the infection as we can, but leave the original artificial joint in place. Cleaning all the pus and infected tissue is called debridement. We usually swap out any easily removable parts of the artificial joint for new ones, but we leave most of the artificial joint in place, and that is why it is called implant retention. The other common type of surgery is called a revision. Like a DARE, in a revision we open and clean out the joint space, but instead of leaving the artificial joint in place, we remove all the components and replace them with new ones. This type of surgery can either be done as one stage, the old one is removed and the new one is put in at the same operation, or in two stages. In a two-stage revision, the infected artificial joint components are removed and replaced with a temporary joint replacement made of special medical cement, which has antibiotics mixed in with it. And then weeks to months later, the temporary one is removed and the new permanent artificial one is implanted. Whether it's a one-stage or a two-stage revision, the main feature of a revision is that the infected artificial joint is completely removed, but in a DARE it is left in place. There are pros and cons to each of these operations. A DARE takes a shorter time for the surgeon to do and may have a lower chance of complications, such as bleeding, but also may have a lower chance of curing the infection. This is because some of the bacteria can hide on and in the artificial joint that's left in place. A revision operation where the old joint is replaced with a new one probably has a higher chance of getting rid of the infection completely, but it may require extra operation and might have a higher chance of complications. The way we treat joint infections surgically has not been previously compared in a large randomised trial, so we don't know for sure which type of surgery is the best or more effective, and that is why we're doing the roadmap trial. To help you understand prosthetic joint infection and possible complications, you can find more information at the roadmap website in the patient resources section. You should always speak with your doctors about the risks for you of surgery. If you agree to participate in the roadmap trial and in the surgical domain, we will check whether you are eligible for this domain or not. To be eligible, the research team and your treating surgeons need to think that either a DARE or a revision are both safe and reasonable choices for you, and that will depend on the type of infection you have and how long you've had symptoms for and your medical history. If you are eligible, you will be randomly allocated to either have a DARE, where the artificial joint is cleaned and left in, or to have a revision surgery, where the artificial joint is swapped out with a new joint. If you're allocated to have a revision, your surgeon will choose whether it's a one-stage or a two-stage revision in discussion with you and your treating team. Further information and videos can be found at the roadmap website and, of course, from your medical team and research staff, and they will answer questions that you may have. We hope that you will consider participating in the roadmap study.